How to use Meloxicam correctly, dosing science you can't ignore. Hey everyone! If you've been prescribed Meloxicam for arthritis or severe pain, you need to know how to use it correctly. This isn't just another pain pill, it's a powerful NSAID with serious risks if misused. I'll break down the science-backed steps to maximize benefits and avoid dangerous side effects. Let's dive in. 1. What is Meloxicam? Quick science. Meloxicam is a prescription NSAID, non-steroidal anti-inflammatory drug that blocks inflammation-triggering enzymes, COX-2. But here's the critical part. Unlike over-the-counter NSAIDs, it's long-acting and carries a black box warning from the FDA for cardiovascular events and stomach bleeding. It comes in tablets, liquid, or injections for severe pain, but only use the form your doctor prescribes. 2. How to use Meloxicam. 3 evidence-backed rules. Rule 1. Always take it with food. Science shows taking Meloxicam on an empty stomach increases GI irritation risk by 40% per American Journal of Gastroenterology. Pair it with food or milk to create a protective barrier. This reduces nausea and ulcers. Never skip this step. Rule 2. Patience is non-negotiable. Meloxicam isn't instant relief. Studies confirm it takes 2 to 4 weeks to reach peak effect, Arthritis and Rheumatism Journal. It builds up in your system to suppress inflammation long-term. Don't double your dose if pain persists, call your doctor instead. Rule 3. Avoid these deadly interactions. This is life or death. Blood thinners, warfarin, Eliquis. Meloxicam can spike bleeding risk by 60%, Journal of Thrombosis and Hemostasis. Blood pressure meds, lisinopril, etc. It reduces their effectiveness, raising heart attack/stroke risk. Other NSAIDs, ibuprofen, aspirin, combining these can cause stomach ulcers or kidney damage. Always disclose all meds to your doctor, including supplements. 3. Side effects, red flags versus normal. Common reactions, affecting 5 to 8% of users, include headaches, diarrhea, or mild swelling. But stop taking it and seek emergency care if you see black/tarry stools, stomach bleed sign, chest pain or slurred speech, stroke warning, swelling in limbs/face, kidney issue signal. Research in BMJ links NSAIDs like Meloxicam to a 2-4x higher GI bleed risk, so stay alert. 4. Critical pro tips from pharmacists. Timing matters. Take it at the same time daily for steady blood levels. Alcohol equals absolute NO. Boosts ulcer risk by 300%, Gastroenterology Review. Hydration is key. Dehydration worsens kidney strain. Aim for 8 glasses of water/day. Never share prescriptions. Dosing varies by condition, e.g., osteoarthritis versus rheumatoid arthritis. Meloxicam can be life-changing for chronic pain, if used right. Recap. Take with food, never mix with NSAIDs/blood thinners, and watch for bleeding signs. Always consult your doctor before starting or stopping. Hit subscribe for more science-backed health tips, and drop questions below. Stay safe and informed. Prescribed Meloxicam? Do not guess your dose. One wrong move risks stomach bleeds or kidney damage. I'm breaking down exact dosing for arthritis and pain, backed by clinical guidelines. Get this right or don't take it. Let's go. 1. Adult dosing, osteoarthritis and rheumatoid arthritis. For tablets/disintegrating tablets. Start at 7.5 mg once daily. Max increase to 15 mg only if pain persists. For capsules, start lower at 5 mg once daily. Max dose, 10 mg daily. Critical, tablets versus capsules aren't interchangeable, systemic exposure differs, FDA pharmacokinetic data. Never self-adjust. If 7.5 mg fails, talk to your doctor, don't double up. 2. Severe pain? For Meloxicam, hospital use only. 30 mg 4 bolus over 15 seconds, once daily. But here's the catch. Pain relief takes 2-3+ hours, clinical trial data. You will need fast-acting backup painkillers initially, and stop ASAP, Use the shortest duration possible to slash bleeding/kidney risks. 3. Pediatric dosing, juvenile arthritis. Only for kids 2+ years weighing greater than or equal to 60 pounds, 27 kilograms. 7.5 milligrams once daily. No exceptions, higher doses show zero added benefit, JRA studies. Under 60 pounds? Tablets are forbidden, use liquid formulations. 4. Kidney/liver warnings, life or death rules. Kidneys. Mild issues? May be safe. Severe kidney disease? Absolutely not. 4. Form banned in volume-depleted patients, nephrology guidelines. Liver. Mild/moderate? Monitor closely. Severe? Use extreme caution, toxicity risk soars, hepatology evidence. 5. The golden rule of Meloxicam. Lowest dose plus shortest time equals safety. Exceed 15 milligrams per day? Stomach bleed risk jumps 5x, BMJ meta-analysis. Using greater than 30 days? Demand kidney tests, NSAIDs cause 37% of drug-induced kidney injury, Clinical Journal of ASN. Recap, how to use Meloxicam safely. 1 match form 2 dose, capsule versus tablet is not equal to same. 2 never exceed max daily dose, 15 milligrams tabs/10 milligrams caps. 3 kidney/liver checks first. 4 count days, this isn't long-term candy. Drop a like if this saved you from a dosing disaster. Subscribe for unflinching med guides.